3 months after the start of the coronavirus pandemic, healthcare workers are still wearing PPE to protect themselves from catching COVID-19. And many continue to distance themselves from their families to protect their loved ones. Tom Cummins, the Division Chief Medical Officer of UT Health East Texas, says it's been hard to watch how everything has changed within a matter of months. And for those on the front lines, it's even harder.
Very, very taxing. And watching people suffer through that and knowing we can't allow visitors in that unit, it's been really hard on everybody to watch. You know, we're accustomed to when people are coming to the end of their life, having their family be able to be there and touch them, hold them one last time, pray for them, and with them. And we, unfortunately, for their own safety, we've not been able to do that.
Cummins says not only is this a difficult time, but it's also frustrating when people are not doing their part to help flatten the curve.
They're frustrated. You know, we all thought the disease was coming under control. And then as the orders lifted and we started the reopening of the state, increasingly we're seeing a lot of people out and about, not wearing their masks, not keeping their distance,
causing the spike of cases in Texas. Earlier this week, during a press conference, Governor Greg Abbott said closing Texas down again will be a possibility if COVID-19 numbers continue to rise.
Not taking action to slow the spread will cause COVID to spread even worse, risking people's lives and ultimately leading to the closure of more businesses.
Constantly washing your hands, using hand sanitizer, disinfectant wipes, and spray are all important actions to take to prevent the spread of COVID-19. But Cummins says the most important actions are social distancing and wearing a mask.
Think of it like wearing a seatbelt. You know, we didn't like wearing seatbelts when in the 70s and 80s when that became mandatory. People complained. Now we do it reflexively. It protects you and it saves your life. Wearing a mask unequivocally saves lives.
And remember, if you don't feel good, stay home. And if you have symptoms like a fever or a cough, get tested.
From every healthcare giver everywhere across Texas, I would say, please do those things for yourself, for your families, for your friends, and for our caregivers.
We got you covered. Jacqueline Laura, CBS 19.